Hi, I'm Dr. Celia Dyer. I'm a general dentist in Atlanta, Georgia, and I'm here to talk with you today about missing teeth, when you have multiple teeth missing from your mouth. Let's say you're missing your 6-year molar, the premolar next to it, and you have a big gap in here. Get food caught in here, and people can see in your mouth and see that you're missing some teeth. And so what do you do about that? Okay, I'll start with the simplest treatment and probably least expensive that a dentist might recommend for you, and that would be a traditional partial denture. And that could be anything from plastic to a cast metal, a framework that goes on the inside of the teeth that has attached to it the missing teeth. And you just snap that in sort of like a retainer, and that fills the gap. The downside of that is it puts pressure on the teeth sometimes and can make them mobile if you're a little bit prone toward gum disease. It can accumulate plaque if you drink a lot of sweet tea or something like that. Another way that you could replace the missing teeth is with what would be called a precision partial denture, and that's a more high-tech, better fitting partial denture that is attached to the teeth, not so much with clasps, but with other very high-tech attachments that are less damaging to the teeth and the gum tissue. You also could technically replace any missing tooth with a dental implant, and that would be where a periodontist or an oral surgeon or a general dentist places a titanium, sort of like a little screw, that replaces the root of the teeth that are missing. And then after a period of time, the dentist can make a couple of teeth that can be glued, cemented back onto these dental implants, and you can floss between them just like you could regular teeth. And that would probably be the most expensive way to replace several individual missing teeth. Now let's say you're missing all of your teeth and you've lost them all, and now what do you do? Socially, you need to have teeth to talk, to eat, to enjoy a high quality of life, and so you have a couple of choices for that. The least expensive and simplest would be maybe to go to either a clinic that specializes in dentures, or maybe a prosthodontist who does a lot of maybe even higher quality dentures, and just get a full mouth denture that is shaped to the gum tissue and the remaining jaw, and just pop that in, and it fits pretty well for a while. But over time, you begin to lose the bone underneath the gum tissue when there is no tooth root to help that bone stay in place. And so what happens is the denture becomes loose. You have to use glue and powders and things like that basically to glue it into your mouth. Then you have to have it relined, maybe remade. You might have some embarrassment with speech, or it might come out. And over time, in fact, particularly in the lower jawbone, it becomes sort of like a hockey puck that just floats around in your mouth, and they aren't like they show them on TV with people eating corn on the cob. The best solution when you're missing all of your teeth, and your dentist might recommend this, would be an implant-supported complete denture. And the dentist or oral surgeon or periodontist would place some little titanium screws that replace the roots of the missing teeth. They might need 2, they might need 4. And then you would have an appliance made, a full denture, that would fit over that, and it would just snap on to the implants. So you might have an implant like this with a little special connector on the top of it, and then have a denture made that has a little opening on it that just allows you to snap that denture right into place so that it's secure in your mouth. The bone does not disappear over time. It keeps the bone in place. The denture fits well, and you just have a better quality of life. And this is done by dentists routinely now, and by prosthodontists. So if this is your issue and you're missing a few teeth, you're missing all of your teeth, you need to find a dentist to evaluate your jawbone and your mouth and suggest the various types of treatments you could have to replace these. If you don't have a dentist, you need to get one, and the thing to do is to go to appointmentcity.com on the web and click on Find an Appointment, and you can see a dentist right away and make some plans to replace your teeth. So this is Dr. Celia Dyer, and that's your appointmentcity.com dental tip of the day.